Well, joining us for more on ways we can curb the spread of COVID-19 is Dr. Peter IMOESI. He is a molecular neuroscientist. He joins us on the program via Skype from the United Kingdom. Welcome to the program.
Nigerians.
And Dr. UGONNAYA IGWILO, a public health physician, joins us here in Lagos. Glad to have you.
Thank you for having me.
All right, let's begin with you, Dr. IGWILO, and that is we're seeing interstate travels, and we're being told that this is the reason why our cases are increasing. From your professional angle, how can we stop interstate travels?
Okay, so so far we've seen that some of the security agencies are telling us they're feeling hopeless. Communities are, of course, complaining that some of their communities are being used as routes to, move around or move in between states. I think one important thing we could do is try to find out from either the security agencies or the communities that why is this happening? For example, the security agents, why do they feel hopeless? Are they trained? Are they aware that they have a legal backing to enforce these measures? Did they receive any form of training? Are there things that they think that might help them? Are there challenges they're having? Or would they feel comfortable if there's a supervisor or someone who would be there to even help them address some of these, issues that they're encountering at those borders? And of course, in terms of the communities, you'll be surprised that the communities sometimes have, solutions to some of these issues. They know where the roots are, they know where the problematic areas are, and they can actually be a good source of, information and data.
Okay, let's bring in Dr. IMOESI here. Doctor, how troubled is the scientific community, and this is as a result of the coronavirus, COVID-19?
So the science.
Oh dear, we appear to be having a terrible audio there. We'll probably try to get a hold of you, hoping that we can hear you a little bit more clearly. But let's come back to what you were saying about interstate travel. We're witnessing that people are still moving, and at some point, people are also being smuggled in, and we have states who are returning people back, sending them back. This is, also bringing in some human rights issues with regards to the way things are going. But can we rely on Nigerians to take responsibility for their health? Can we say that they know exactly what this virus is and how to prevent the spread?
Okay, so so far, at least, we know that we've done a form of bottom-up approach in terms of our community engagement. So we are aware that Nigerians now know what the coronavirus is. Now, the problem we might have will be in terms of existing misinformation, like, the barrage of false and conspiracy theories that exist. So that also already counteracts some of the information. So you might have some Nigerians not even believing that such exists. So they might even keep, flouting the rules and, just keep going across the borders. Now, the issue now is, okay, where do we draw the line between trying not to violate, ensure that, okay, people have that, freedom, you also want to make sure that you're not, abusing their human rights. So this is why, I don't know if you remember when Boss Mustafa was speaking earlier on, he was talking about, we have to just keep persuading them. And at the same time, it might come a time when we might have to disincentivize some of these trucks that are carrying, for example, yes, you have that access. We've really the access to move in between states to carry foods and cattle. But when you start carrying people, first of all, you're diminishing the effects of the intervention being done in all states. You're creating more burden on the health workers. So we should also be looking at, for example, when I mean this incentivizing is like having to tax them, because that's what we do on a normal day for things like tobacco, where things that can cause harm to people. You can tax such things, and the tax can even now be put into, for example, the COVID fund. So if you're flouting the rules, you can tax them and say, okay, maybe that could be, a deterrent. I'm not sure, but that could work.
All right, I'm being told we have Dr. IMOESI back on, hoping that you can hear me now. I was just asking what you think about how troubled the scientific community is as a result of the coronavirus.
Thank you. I think the whole world is troubled, and also the science community is also troubled at the moment. And that's why we've got every single individual when it comes to scientific discovery is out there trying to make research, do testing as much as we can.
tell us about what we're learning about the SARS-CoV-2, because there appears to be a lot of research, a lot of data, a lot of studies. How do we sift facts from fiction?
Basically, there's quite a number of peer-reviewed publications out there that basically describe the virus behavioral pattern. So I think when it comes to novelty, we've gone past that a little bit because we understand the structural mechanism of the virus. So basically, to fish out the facts from fictions, you just have to go by relevant publications from well-known journal houses. That's just the way to go about it, because you don't just depend on information out there that are just going around and all. So you need to look at papers published in reputable journals, and based on those papers, you could make your informed decision. And there are quite a number of papers out there at the moment.
Just to quickly get your thoughts about a small study we hear that was conducted in China that found SARS-CoV-2 RNA in the semen of young COVID-19 patients. Samples were taken from those who were acutely infected and those who were just recovering.
Yeah, for that particular study in China, I think there are a kind of issues we need to clarify about it, if it is transmissible via sex. So there's kind of a lot of issues when it comes to transmission of the virus, when it comes to the semen. Also, there are studies also that also clarify that you also have the RNA virus in feces, in human feces, despite the individuals test negative after a period of 4, 5, 6, or 7 days. However, there's no full confirmation if this level of RNA present in feces or in semen is highly transmissible to human when it comes to interaction or when it comes to feces you have when you go to the toilet and all. So they are kind of research that you need more validation to be able to ascertain that, yes, there could be possible transmission via semen, and also there could be possible transmission via the human feces. So it kind of varies here and there.
All right, we appreciate your time, Dr. Peter IMOESI, molecular neuroscientist. Thank you for joining us. We know we'll be talking to you in the course of the weekend. Thank you as well, Dr. UGONNAYA, IGWILO, public health physician. Thank you.